Hey, it's Teresa from Life Beyond Diabetes. And the last few days, we've been talking about some of the scary complications of diabetes, the things that I don't know about you, but when I was diagnosed, I worried about because they're the horror stories that we hear about. And of course, my mind went straight to these horrible things. Um, Today I'm going to touch on the last big one that people talk about, and it's one that you hear about a lot, but it is one of the big deals, and that is diabetic kidney disease. And the formal term for that is nephropathy, which is a kidney failure, a kidney problem. And just like neuropathy is nerve damage, and retinopathy is damage to your retinas in your eyes, nephropathy is kidney damage that's caused by um, high blood sugar causing problems with the blood vessels in your kidneys. So, a similar process that you're too much sugar in your blood vessels causing damage to the cells in your kidneys. Um, so that is one cause of it, and there's a secondary cause also of kidney disease for people with diabetes. That is also a problem for people in the general population as well, not just people with diabetes, that can cause kidney disease, and that is high blood pressure. Now, people with type 2 diabetes are at a higher risk for high blood pressure, and that's something that we'll talk about on a different day. I'll talk about some of the cardiovascular complications that are related to diabetes for a completely different reason than the microvascular diseases that we've been talking about, nephropathy, neuropathy, and retinopathy. But the kidney disease, it does affect, the research that I found, it affects approximately 25% of all people with diabetes eventually. So the reassuring thing that I want to say to you is that it's not going to affect you probably, because you're here learning because you don't want to get sick and you don't want diabetes. You're proactive, and you're here because you want to take care of your body and because you want to learn the things that you can do to take care of your body to avoid the complications. And kidney disease is one of the things that when you stay on top of your diabetes, you can definitely avoid diabetic kidney disease. And this is something that we want to keep under control. So high blood pressure and high blood sugar are two of the main causes of kidney disease, and we can keep those under control. So there's a couple. Again, this is one of those things that your medical provider should be monitoring all along, not just when you have high blood sugar and later stages of your diabetes, but part of your routine care should be labs annually that is looking at your kidney function, and also a urine test that's comparing, and depending on what urine test they do, they're looking for protein in your urine, and sometimes they're comparing your urine test to your blood test. That one is not very common early in the course, and usually that one is only if there is a problem, if you come back with some protein in your urine. But your medical provider who's managing your diabetes should be continually monitoring for your kidney function and looking for changes in kidney function throughout the course of your diabetes. Another thing that your medical providers should be looking at is your blood pressure. And the recommended blood pressure for somebody with diabetes is generally a little bit lower than somebody in the general population, because we want to making sure we're doing everything we can to protect your kidneys. And there are a couple of the major organizations that make medication recommendations for people with diabetes do recommend that people with diabetes go on low doses of blood pressure medication, even if they don't have high blood pressure, as protectant for their diabetes. So I will tell you, I don't have high blood pressure, but and my primary care provider didn't put me on a blood pressure medicine, but I had looked at the recommendations, and I requested to be on a low dose blood pressure medication as as something to protect my kidneys. And part of that is that I have a family history of kidney disease, and so again, very individual treatment. As everything I talk about, everybody is very individual, and I want you to be making sure that you're making decisions with your medical provider because you are an individual. So giving you some information, everybody's really individual. It needs to be individual treatment. So your medical provider is going to be monitoring your blood pressure, monitoring your kidney function, possibly putting you on blood pressure medicine to protect your kidneys. There's another thing. There is a class of medication that is given for people with type 2 diabetes, and these are called SGLT2 inhibitors. And they are, I briefly mentioned them when I was talking about the ketogenic diet. They're a medication that if you are doing a ketogenic diet, you should not be taking an SGLT2 inhibitor. But they are, the way that they work is by filtering out extra sugar through your kidneys. So they work in the kidney is where they work. And there's some research coming out now showing that they may be protective against some of the diabetic kidney disease. Now, I will say that this is new research that we're just learning about, so it is not yet recommended to use them, as none of the major organizations are recommending that they be used as a kidney protectant against diabetic kidney disease. But that may be something we see in the future, and that's definitely something that you might want to talk to your provider about if that's something that they're considering that drug for you. Is saying, is this something that we want to look at for protecting my kidneys, or are we not at that point yet? So again, diabetic kidney disease, it is something that's out there. If you're here and you're looking to take care of your body, I don't think it's something that's going to affect you. And I want to just remind you, you got this. And because you're here, you're doing what you can to take care of your body. And that's it about diabetic kidney disease for today. If you have any questions, of course, always drop me a comment. Tomorrow I will be back here at 2:30 Pacific, and I'm actually going to be answering somebody's question. They asked me about, it was about exercise and timing exercise around fasting blood sugars and eating. And I'm going to talk a little bit about exercise and blood sugar and eating, and how you can time that and what might work best for certain people. So I'll see you back here tomorrow at 2:30. Bye.